to more feedback directly from patients. And because, I said this to somebody earlier, what I like about including patients is patients are messy. Right? They don't follow the rules that we've built up, and they shouldn't, because we need to hear healthcare on their terms. And so we had scheduled 2 patients who are going to speak to you today. One is Carly Medosch, followed by Garth Callahan. Garth couldn't make it. So we have Jess Jacobs, who is another patient, but Jess can't make it because she was a patient and she had patient issues. So what we're going to do is Carly's going to come up and speak, and we're going to go to the panel afterward where Kezia, our keynote, and Carly will join Diana Kehoe, who has helped create some of these patient stories, for a Q&A about patients, their experiences, what they've heard and they've seen here at the conference, and also give a chance to talk with you and to answer your questions. So I'm excited to bring up Carly. Carly has many things, but the thing that she has drawn identity from is 21 years as a chronic illness patient. She's worked with patient groups. She's advised PCORI. I've heard her story, and it's exciting to hear her here. Please, everybody, welcome Carly Medosch.
So I have a bunch of notes. Can you turn on this one? I have a bunch of notes because one of the side effects of one of my illnesses is brain fog. So if I space out, they're over here, but I'm going to try to get away from the stand. So like Chris said, I've had Crohn's disease for 21 years. I was diagnosed at age 13, and I was lucky because my diagnosis only took 6 months. But in that time, I went through at least 3 primary care doctors, and the second one thought my mom was starving me so that I could be thin and she could vicariously enjoy being thin through me. So we were very lucky that she was not reported to Child Protective Services. But imagine having a child who loves going to school and wakes up very easily and is suddenly crying because she wants to stay in bed, and she's slowly starting to lose weight and not being as active. And at that time we weren't experienced patients, and so we didn't know what was going on. And so the only thing you can think of is that you have some kind of rare disease that you're going to die from. And we would go from doctor to doctor, and no one could help us in the way that we needed. And we didn't know enough to even know what kind of specialist to go to. And it was just extremely scary. And so ultimately, my mom was at her podiatrist office, and she was so stressed out that she had sores in her mouth. And she was talking to the nurses and the staff at this office, and they said, get on the phone and call Richmond, which is the town south of us, and find her a pediatrician there. And just speaking to the pediatrician in Richmond, no exam or anything at this point, she says, I think you have Crohn's disease. And it was amazing, but it was also another door. We didn't know what Crohn's disease was, but at least we had a name then, and we could go ahead and do research, and we could reach out and find other patients and find out about it. But until you have enough knowledge to go and find out what path you're going on, it's extremely scary. So I've been a patient for 21 years, and that kind of new patient experience has sort of worn off. And so about 3 years ago, I was diagnosed with fibromyalgia. So I'm experiencing that confusion and fear, and the idea of doctors not thinking it's a real illness, or not believing that I have it because I look okay, or I fake it really well. And so I'm kind of learning that experience all over again of having to navigate something that's new. And I get really frustrated a lot of the times because patients work so hard, and it seems like what comes back to us is all these messages about how we're not doing enough, we're not working hard enough, we're not compliant enough, we're not adherent enough. And I know that maybe we don't have the best language, maybe there's not a term that's better to use, but when you're a patient, you hear those things, it sounds like you're not being compliant. That means you're not taking the medication that I told you you need to take, and I don't care that you can't afford it. I don't care that there's a medication shortage. I don't care what it takes to get yourself to the pharmacy to pick that medication up. But all I care about is what I told you, and that you're not doing it, and that's the end of the conversation. And there's not not enough recognition of the amount of work and effort it takes to be a patient. When you go to the doctor and you see how many different signs at the checkout that say, payment upon visit, and if you're late, there's a $50 fee, and if your check bounces, there's a $25 fee, and someone was talking yesterday about what if doctors could rate their patients. What if the doctor is rating me because I can't afford my medication, and then I get kicked out of his practice or something. So why is it that we will talk about patients with people, and sometimes people like to use the word consumer, that a patient's a consumer. But when I think of being a consumer, I think of places like Nordstrom, and I think of places like Disney World. And you walk in and there's ample free parking, and everyone is smiling. And at Nordstrom, any single person there can help you with your return, they can help you with your question. If they don't have what you need, they will order it for you and ship it to your house for free. Everything is clean, the restrooms have toilet paper. And then you go to a hospital and you have to have an x-ray done, and you don't know where to park, and they tell you it's going to be $10 to park for the day because you live in DC and everything's expensive. And you show up for your appointment time and you have to wait in a hallway because there's not an adequate waiting room, and it's cold, and they might put you on a wheelchair and leave you for an hour and forget about you because they're busy. And the person that checks you in is grumpy because that's just their job, and they do the same thing every day. And I have a day job and I'm probably grumpy a lot of the time too. But my day job doesn't meet people on the worst day of their life. And when you're going in to have a test, or you're rushed to the emergency room, or you're a parent bringing your child for a checkup and they're sick and you don't know what's wrong with them, that's maybe not the worst day of your life, but it's definitely not the best one. And when you can go to Disney and everyone is smiling and they're happily picking up garbage and they're smiling and, oh, thank you for letting me throw away this water bottle for you. Why is it so different? And if there's so much money being spent on healthcare, why aren't we getting a better experience? And if these things have already been invented, you're not reinventing the wheel, you just need to use the wheel that already exists. My doctor, my specialist, my gastroenterologist, they're in a big health system in Richmond, and they have 3 different portals for one doctor. When I go, I can schedule my appointment online, and what that looks like is you go to the website and you fill out a web form, and there's not even drop downs or clickable options. You type in your top 3 choices for time and date of the appointment that you want. And then a few days later, some random person calls you and says, I might say Monday morning, Tuesday morning, Friday morning. Your appointment is Wednesday at 3:45. What happened? Why didn't I get any of my choices? Why do you ask me to put in my choices? Oh, well, that doctor is off on Monday, and they're in procedures on Friday, and they only work until 4 every other day, and, well, why doesn't your web system show me that? You're not saving money employing a person to have to call me if I could do it all on the website. And the thing is these tools exist. I can go to a place that waxes eyebrows, and you can go to their website and you can see a calendar, and you can see the day, and you can see the schedule, you can see their first appointment and their last appointment and all the ones in between. You can see which ones are taken, and they're done by the schedule, so 15-minute increments. You can click exactly which one you want, and they send you a confirmation email. They thank you for using their service. It exists, and there's no reason why my doctor can't be using this tool, except for no one has thought it's important enough to implement. So when you want to engage with a patient, what's really important, engagement is not a one-off. It's not sending out a tweet that says, hey, don't forget to eat healthy. It's not saying, hey, I see you haven't refilled your medication. You should probably do that. But if you have any questions, I don't want to hear about it. It's a relationship, and you really need to just write this down and get it tattooed on your arm. Listen. You need to listen. You need to talk with patients, but you also need to sometimes just be quiet and just listen to them. And not just hear them, but listen and understand what they're telling you and what are they not saying verbally. And you need to have empathy. You need to try your best to understand the situation, understand where we're coming from. Admit when you don't know something. I've been to doctors and they had too much ego and too much pride to tell me that maybe I wasn't the best fit for them, or to refer me to someone. And I've even had a doctor that's fired me because I told him I was going to seek a second opinion. And he said that he could not coordinate my care if I was going to go see somebody else. But this is a doctor that I spent weeks trying to get a hold of on the phone, and the only reason he called me back was because I had left him a message that said, I'm on my way to a second opinion, so if you could call me back, I'd really appreciate it. And he called me back to cuss me out and tell me that he was going to fire me. That's not engagement. That's abuse. Seek help. I mean, we talked yesterday about the patients who are hacking their medical devices, and people, there are engaged people, and you need to find them, and you need to help foster those people and help them develop into more engaged people, and help them find other patients and bring everybody along, because those are going to be the people that will go out in your community and bring you other patients and make all the boats rise. And recognize the humanity in people. So if patients are people and people are sometimes patients and we're all humans, just remember that, because if you would treat your loved one a certain way, treat a patient the same way. And don't forget to listen. And thank you so much for your time. I really appreciate it.